What causes a hook nose? So a hook nose is a prominent dorsum. So that's this part of the nose, or where you have the bump. And then also, most of the time, this means that the tip is downturned. Usually this is genetic, so you can look at some of your family members and maybe you know exactly where this came from. Other causes can be trauma. If you're hitting the nose and you lose support in the tip, that can make the tip actually go down and make a little bump look like more of a big bump. And also trauma can cause a bump, because if you have nasal bones that are in the midline and everything's lined up and then you get bumped, it can push those to make this bump here to make that part of a hook nose. How do you fix a hook nose? The biggest part of a hook nose, the way we fix it, is to address the tip. And this is something we understand much better now as surgeons than we did 10 years ago, 20 years ago. And so a lot of times what it is the tip does not have the support that it needs. And so this droops down, even if it's just a little bit, in creating more of this hook here. And so we re-support the tip, we put it back into the place that it needs to be, and then take down the bump that you have here. So you have a nice, strong, straight profile, or a little bit of a scoop if that's what you prefer, a tip that's in the good position, and everything is more in harmony with your other features. Is hook to nose surgery safe? Yes, the surgery to fix a hook nose is safe. It is minimal as far as risks go. There are risks with any surgery, of course, but whenever you compare that to things like heart surgery, lung surgery, abdominal surgery, it is very minimal compared to that. But you do have to be in healthy enough condition to be able to undergo surgery. So it depends on your surgeon, the way that the anesthetic is given to you, whether it's general anesthetic, IV anesthetic, or even local in some cases. But you need to check with your surgeon to see how that surgery is done and make sure you're healthy enough to have that anesthetic. Most of my rhinoplasties I do with general anesthetic. It is just much more comfortable for the patients. I'm able to get a better result. It is a more controlled situation. So I do ask that the patient be healthy enough for general anesthesia for most of my rhinoplasties. Have questions? I help people like you every day and would love to help you. Give us a call or email anytime.